In 1896, something strange was happening in San Francisco. Doctors were experimenting with a new kind of radiation called X-rays. Nobody really knew what they were dealing with yet. They knew it could pass through the human body. They knew it could expose a photograph of bones. And very quickly, they realized that it could be incredibly useful in medicine. But they didn't know much about the risks. There was a young woman in San Francisco who became fascinated by this new technology. Her name was Elizabeth Fleischmann. She wasn't a doctor. She wasn't a university professor. She had originally worked as a bookkeeper. But within a few years, she would become one of the most accomplished X-ray operators in the United States. And she would eventually die because of the work she loved. Elizabeth Fleischmann was born in California in 1867. Her parents were immigrants from Austria, and the family was not particularly wealthy. She left school fairly young and went to work. For a while, her life was fairly ordinary. Then her mother died. Elizabeth went to live with her sister and her brother-in-law, Dr. Michael Wolfe, who was a physician in San Francisco. She worked as a bookkeeper in his office. And that's where she first encountered medicine more closely. Then Röntgen discovered X-rays. The news spread incredibly quickly. Within weeks, doctors and scientists all over the world were trying to reproduce the experiment. Elizabeth was fascinated by it. She went to a lecture about X-rays, started studying electricity, and became determined to learn how the equipment worked. Eventually, she borrowed money and bought her own X-ray apparatus. Elizabeth set up an X-ray laboratory in San Francisco, and she turned out to have a real talent for it. She understood the equipment, she understood photography, and, perhaps most importantly, she was patient. Early X-ray images were not easy to make. The exposures could take a long time, and getting a useful image required considerable technical skill. Doctors began sending patients to her, and she started producing images that were genuinely useful. Then, the Spanish-American War began. American soldiers were coming back with bullets and pieces of metal buried inside their bodies. Surgeons had a problem. If you couldn't see the bullet, finding it during surgery could be extremely difficult. X-rays changed that. Elizabeth Fleischmann began working with the US Army, producing radiographs of wounded soldiers. One of the images associated with her work showed a bullet lodged inside the skull of a soldier named John Gretzer Jr. Think about what that meant for a surgeon at the end of the 19th century. Instead of opening the skull and searching around, the surgeon could first look at an X-ray and see where the bullet was. That was an extraordinary development, and Fleischmann became very well known for this kind of work. Her images were considered excellent. She became a member of the Röntgen Society of the United States and was one of the few people in that professional circle who wasn't a physician. But there was something happening to her that she couldn't see. Her hands were being damaged. At the time, people didn't understand why. And this wasn't just a problem for Elizabeth. It was happening to other early X-ray workers as well. They would put their hands near the X-ray tube. Sometimes they would expose their own hands deliberately. Sometimes they would use their skin as a rough indication of how strong the radiation was. There was no dosimeter to tell them how much radiation they had received. There was no occupational exposure limit. There was no radiation safety officer standing in the room telling them to step back. They simply didn't know. And Elizabeth was exposed a lot. She worked long hours. Some accounts describe her spending 12 hours a day in her laboratory. Over time, the skin on her hands became badly damaged. At first, there was uncertainty about what was causing it. Some people thought the chemicals used in photographic processing might be responsible. But the injuries kept getting worse. Eventually, there was no real doubt. She had radiation burns. And then something even worse happened. The damaged skin developed cancer. Elizabeth began looking for ways to protect herself and other people working with X-rays. She experimented with shielding. She investigated materials such as lead and other metals. She was beginning to understand that the operator needed protection just as much as the patient did. But by then, the damage had already been done. In 1905, doctors amputated her right arm. They had to remove not only the arm, but also the shoulder blade and collarbone. It sounds almost unbelievable now. A woman who had spent years operating X-ray equipment had lost her arm because of the radiation coming from that equipment. And yet, the cancer continued. It spread into her chest and lungs. Elizabeth Fleischmann died on August 3, 1905. She was 38 years old. That's one of the details that makes her story so difficult to forget. 38. She had been working with X-rays for less than 10 years. And in that short period, she had helped establish radiography as a practical medical tool. She had helped surgeons locate bullets. She had produced some of the early military radiographs in the United States. She had become respected for her technical ability. And she had also become one of the earliest people to suffer the full consequences of radiation exposure. There is something else worth remembering about Elizabeth. She wasn't simply someone who was injured because nobody cared about radiation safety. She was actually beginning to think about the problem herself. She was trying to find better ways of protecting X-ray workers. But science often works like this. You don't always understand the danger before you encounter it. Sometimes the first evidence comes from the people who are exposed. That was certainly true in the early history of radiology. The first X-ray machines were primitive. The exposures were long. The operators stood close to the equipment, and nobody knew how much radiation was too much. It took years of injuries and deaths before the profession developed the safety practices that now seem obvious. Today, when a radiographer takes an X-ray, the exposure might last only a fraction of a second. The operator steps behind a barrier. The equipment is carefully calibrated. Occupational exposure is monitored. There are rules about dose. There are rules about shielding. And there are people whose entire job is to make sure radiation is being used safely. Elizabeth Fleischmann had none of those protections. She had an X-ray machine and a photographic plate, and she was trying to figure out what this new technology could do. She succeeded, perhaps more than she ever realized. The work of people like Fleischmann helped turn X-rays from a scientific curiosity into one of the most important tools in medicine. But there was a price, and Elizabeth paid an enormous part of it. When we look at an X-ray today, we see something completely ordinary. A fracture, a chest, a joint, a tooth. Something a radiologist can interpret in seconds. It is easy to forget how extraordinary that image would have seemed in 1896. And it is even easier to forget that the people who created those first images had no idea what the technology might eventually do to them. Elizabeth Fleischmann did. She discovered it gradually, painfully, and far too late. She was only 38 when she died. But the work she did during those few years became part of the foundation of modern radiography. So when you hear the name Elizabeth Fleischmann, don't remember her only as a victim of radiation. Remember what she actually did. She saw a new technology. She learned how to use it. She became exceptionally good at it. She used it to help wounded soldiers. And when she began to realize that it was hurting the people who operated the machines, she tried to do something about that too. That's what makes her story important. She wasn't simply a casualty of early radiology. She was one of the people who helped build it. And unfortunately, she was also one of the people who taught the rest of us what it could cost.